Schizophrenia NCLEX practice. Question. Nurse Dorothy is evaluating care of a client with schizophrenia. The nurse should keep which point in mind? Frequent reassessment is needed and is based on the client's response to treatment. Because the client responds to treatment in different ways, the nurse must constantly evaluate the client and his potential. A premorbid adjustment must also be considered. Assess if incoherence in speech is chronic or if it is more sudden, as in an exacerbation of symptoms. Establishing a baseline facilitates the establishment of realistic goals, the foundation for planning effective care. Question. Gio told his nurse that the FBI is monitoring and recording his every movement and that microphones have been placed in the unit walls. Which action would be the most therapeutic response? Tell Joe that this must seem frightening to him but that you believe he is safe here. The nurse must realize that these perceptions are very real to the client. Acknowledging the client's feelings provides support. Explaining how the nurse sees the situation in a different way provides reality orientation. Recognize the client's delusions as the client's perception of the environment. Recognizing the client's perception can help you understand the feelings he or she is experiencing. Question. Which of the following client behaviors documented in Gio's chart would validate the nursing diagnosis of risk for other directed violence? Frequent angry outbursts noted toward peers and staff. Anger is an important factor that indicates the potential for acting out. Because the client is angry with both peers and staff, any acting out would probably be directed toward others. Frequently assess clients' behavior for signs of increased agitation and hyperactivity. Early detection and intervention of escalating mania will prevent the possibility of harm to self or others, and decrease the need for seclusions. Question. Nurse Winona educates the family about symptom management for when the schizophrenic client becomes upset or anxious. Which of the following would Nurse Winona state be helpful? Encourage the use of learned relaxation techniques. The client with schizophrenia can learn relaxation techniques, which help reduce anxiety. The family can be supportive and helpful by encouraging the client to use these techniques. When client is ready, introduce strategies that can minimize anxiety and lower voices and worrying thoughts. Teach client to do the following. Focus on meaningful activities. Learn to replace negative thoughts with constructive thoughts. Perform deep breathing exercise. Use a calming visualization or listen to music, or seek support from staff, family, or other supportive people. Question. Drogo, who has had auditory hallucinations for many years, tells Nurse Callie that the voices prevent his participation in a social skills training program at the community health center. Which intervention is most appropriate? Teach Drogo to use thought-stopping techniques. Clients with long-lasting auditory hallucinations can learn to use thought-stopping measures to accomplish tasks. In this technique, when the obsessive or racing thoughts begin, the client says, clearly and distinctly, stop. This then allows the client to substitute a new, healthier thought. Many therapists encourage the client to, at first, yell out the stop. This helps focus the attention on the word and away from the obsessive thought. Later, the client will be able to mentally yell the word to themselves without needing to say it aloud. Question. Circe is diagnosed as having disorganized schizophrenia. Which behaviors would Nurse Sansa most likely assess in the client? Extreme social withdrawal, odd mannerisms, and behavior. Disorganized schizophrenia is characterized by regressive behavior with extreme social withdrawal and frequently odd mannerisms. In the most general sense, disorganized schizophrenia refers to the disorganization of thought processes, behavior, and affect regulation, emotions. The DSM-IV included 5 subtypes of schizophrenia, including disorganized, paranoid, catatonic, undifferentiated, and residual. The subtypes were removed from the current version of the DSM-5, released in 2013, as it was determined that they were not helpful when treating the disorder. Question: Jamie has a diagnosis of schizophrenia with negative symptoms. In planning care for the client, Nurse Brienne would anticipate a problem with motivation for activities. In a client demonstrating negative symptoms of schizophrenia, a volition, or the lack of motivation for activities, is a common problem. These negative symptoms are so called because they are an absence as much as a presence. Inexpressive faces, blank looks, monotone, and monosyllabic speech, few gestures, seeming lack of interest in the world and other people, inability to feel pleasure or act spontaneously. It is important to distinguish between lack of expression and lack of feeling, between lack of will and lack of activity. When questioned, patients with schizophrenia often express a full range of feelings and desires. Question: The family of a schizophrenic client asks the nurse if there is a genetic cause of this disorder. To answer the family, which fact would the nurse cite? D. Genetic factors can increase the vulnerability for this disorder. Research shows that family history statistically increases the risk for the development of schizophrenia. Genetics also play a fundamental role. There is a 46% concordance rate in monozygotic twins and a 40% risk of developing schizophrenia if both parents are affected. The gene neuroglin, NGR1, which is involved in glutamate signaling in brain development, has been implicated, alongside desbindin, DTNBP1, which helps glutamate release, and catecholamine OMETHYLTRANSFERASE, COMT polymorphism, which regulates dopamine function. Question: Ramsey is diagnosed with schizophrenia paranoid type and is admitted to the psychiatric unit of Nurse Labs Medical Center. Which of the following nursing interventions would be most appropriate? Establishing a non-demanding relationship. B. Encouraging involvement in group. A non-threatening, non-demanding relationship helps decrease the mistrust that is common in a client with paranoid schizophrenia. Use a non-judgmental, respectful, and neutral approach with the client. There is less chance for a suspicious client to misinterpret intent or meaning if content is neutral and approach is respectful and non-judgmental. Question: A client tells the nurse that psychotropic medicines are dangerous and refuses to take them. Which intervention should the nurse use first? Ask the client about any previous problems with psychotropic medications. The nurse needs to clarify the client's previous experience with psychotropic medication in order to understand the meaning of the client's statement. Attempt to understand the significance of these beliefs to the client at the time of their presentation. Important clues to underlying fears and issues can be found in the client's seemingly illogical fantasies. Explain the procedures and try to be sure the client understands the procedures before carrying them out. When the client has full knowledge of procedures, he or she is less likely to feel tricked by the staff.